All right, hello and welcome to SPX 2021 with Beyond Clean. I am so excited to host this panel discussion with the folks at Microline Surgical. I'm thrilled to welcome the panelists for today's discussion. We're going to be talking about total cost of ownership when it comes to switching from reusable to disposable products and the impact that that can have on a specific department. I think the end user perspective is incredibly valuable, and so we're excited to get into this discussion today. Joining me for this panel discussion is John Pendlebury. John is the Northeast Regional Sales Manager for Microline Surgical. He covers Maine to Virginia to Ohio, and this is his second year participating with the Beyond Clean SPX Virtual Vendor Expo. So John, we're really excited to have you back. Also joining us for today's discussion is Joseph Lisenby from Microline Surgical. He's the Senior Territory Manager serving Virginia, Maryland, and the DC area. And finally joining us is Adam Haas, Sterile Processing Education Coordinator at Sentara Rockingham Memorial Hospital. Adam started working with the Microline team and specifically with Joseph around the summer of 2018. And something I'm really excited to get into is Adam's personal account in transitioning to the Microline products. And so we'll get into that more specifically. Before we start and get into the details, John, I'm going to hand it over to you just to give a brief overview of why this discussion is being had and what you're excited for the listeners to learn today.
Sure. So in SPX 2020, we introduced the total cost of ownership program, and it had some really good concepts there of basically trying to work with our customers to shrink down their laparoscopic sets so they can create this greater efficiency in the OR and SPD. Certainly, we think we could help control cost, replacement cost, and repair cost with our system. There was this opportunity to, address surgical site infections with a reposable solution, reusable handle and disposable tip. And what's interesting here in SPX 2021, nothing's really changed. It's still a very new concept, and really our goal over the course of the next year is to get out to as many of our customers or new customers to present this program and how it might affect their health. And that's really the key is really the way our reps, we're going in there and we want to listen. We want to hear, we want to see, we want to feel what the pain might be. And then off of that, come up with some type of solution that could benefit them.
Wonderful. And speaking of solutions, we're going to talk about one specific solution and how it transformed one department's ability to care for their patients. So, Adam, we're going to shine the spotlight on you because you actually went through this conversion in your facility and have seen firsthand you've seen firsthand the impact of that transition. So if you wouldn't mind giving us a little idea of what your situation was prior to the Microline conversion, how were your trays set up, what were your challenges that you faced with that particular setup prior to the conversion?
So I did want to clarify when I started back here at Sentara. So I wasn't here in 2018, I think, when technically our TCOD started. I was here from 2012 to 2016, just as a regular technician. And then in 2016, I was hired at Piedmont Virginia Community College in Charlottesville to teach a sterile processing program there. So I did that for 4 years. And then I was asked to come back in 2019 as a process improvement measure to help fix some errors and different things. And then I kind of came in the middle after we had begun changing, but I had a lot of experience working with the old system, the old instruments, the old systems, and was definitely participating a lot with the issues that we were having.
Can you elaborate on what some of those issues were that you experienced prior to the conversion?
Yeah, so we had all 3 generations of laparoscopic instrumentation that we were using at the time. We had tons of the first generation that had no flushing ports, so there was no way to even flush fluids through those instrumentation to make sure that the moving parts were clean of any debris. Then we had second generation, which had flushing ports, but I remember in those days, we would actually hook up syringes to those flushing ports, and half the time you wouldn't even be able to get fluid to push through them. So we would just send them back and forth from from processing to decontamination, trying to get them, hey, let's sonic again, see if we can break it free. But just the fact that you're having issues getting fluid through those instruments shows that there is heavy blockage and major issues with that.
So once the conversion happened, what was the main aha moment? I know this is kind of a curveball question, but what was the one thing that came to mind for all of the staff in sterile processing where they were like, wow, this was worth it?
Here recently, so we were having issues where we tracked the measured daily improvement, and we put out a report every day that shows the number of errors, the number of instruments processed, and different things like that. And one of the big issues that we were getting back from the OR was they kept saying that our lap chole trays kept having like black specks inside of them. It looked like, sometimes it would even look like a little bit of confetti out of them. So, I asked staff multiple times, hey, show me these sets right as they are opened in the OR to see what we're dealing with. And eventually we got one down, and it literally looked like black confetti had come out of the end of a grasper. And when we pulled that instrument out, and then you could tap it onto a white sheet of paper, and it looked like just like black flecks would just like fall out of the instrument. So I immediately took it up to our manager, who took it to our director and showed all the surgeons, and they were all horrified, that this could be an instrumentation, and then there's no way for our techs to inspect it, ensure that it's clean or anything like that. So that's why moving to the third generation, especially with Microlines having the O-ring tips, which help prevent backflow of bioburden into the instrument, that it really helped us move forward. And we almost never have the issues now that were regularly coming up before.
And we also have Joseph on the line. And Joseph, I know you were instrumental in the conversion to the Microline products at this particular facility. How was TCOD, or total cost of ownership disposable, proposed? And what did you propose as the advantages of?
Yeah, so from first call, I called on Sterile Processing. I set up a meeting with that manager and that supervisor. I went in, and at that point in time, we only had maybe a 5-slide presentation that highlighted our handle being a one-piece instrument with a disposable tip and a robust flush port for lumens. And so I proposed our 3 key concepts: being able to, first of all, streamline your tray. Going from, at that point in time, I didn't even know what the trays look like. This was just step one. I hadn't seen a count sheet. I hadn't been in SPD, none of those things. Obviously, I later found out that I was music to their ears, but it started off by streamlining their trays from 12 plus instruments down to about 4 or 5, only pulling the tips you need according to the case. So SPD loved that concept, standardizing the trays, reducing what's in there. 2 was cost containment. Not turning over clean instruments, right? Sending all those instruments out for a lap chole case. They use 3, sending all the instruments back downstairs to be processed, right? Very inefficient. And our third concept, actually, John, at that time, we didn't have, which now we've highlighted to help support the hospital's efforts to reduce surgical site infection rates. So I pitched at least those first 2, music to their ears. They sent me up to the OR manager. I met with the OR manager that day. I vividly remember his story. He explained their lap program as being the fruit basket that is at the Super Bowl party. So what he was saying was he understood that there were problems downstairs. I talked to the coordinators a couple weeks later. Met with them. Everybody loved it. I'd say the biggest challenge upstairs was just matching what they were currently using. Wavy graspers, Marylands, things of that sort, just making sure all the surgeons were satisfied. We trialed and we converted.
What an incredible story. You mentioned that you worked with OR manager, you had mentioned the coordinators. Was there anyone else involved, and maybe Adam wants to talk through this as well, who else in the hospital participated in the decision to make this conversion, and kind of what were their main questions that they had when exploring this option?
So the SPD director at the time had heavy influence. The director of surgical services was the next step, and there's a materials manager involved as well, which I'm not totally privy to how that process worked, but Sterile Processing's husband is the manager on that side. So she had heavy influence. I was around for one conversation. I remember her saying, "This is going to be so beneficial to us, make this happen." And it eventually did. Now, on an IDN level, it has to leave this one location and go through the chain of command. There's 12 different individuals up the C-suite ladder, and it goes up one side, as it was explained to me, and everything has to be checked off again as it comes back down to the actual facility to be approved. So there's a lot of steps.
So the important point that Joe did was first go down to SPD and talk to the people down there and find out the information, what was used, how it's being used, what is the process, all of those things. That was the critical piece, because from there it kind of set him the roadmap as to where else he needed to go, what other people he needed to talk to, and certainly with the influence of the people in SPD, they were supporting that also. So that's the critical thing, I think, in terms of the way our reps are approaching, customers today. It's to not go in there and start selling. It's to go in there and listen and learn and see things, and then from there work through a strategy process that's going to support their needs.
And Adam, we talked through the importance of Microline really being a resource, really coming in and listening to the staff at your facility and finding out what the pain points are and figuring out what the best solution is for your situation. And a specific question I have for you is, now that this conversion has taken place, you've adopted the TCOD that was proposed, how has it been received by staff and surgeons?
So I'd say every change comes with its challenges. People aren't always used to the same things when they change, but I'd say now it's so much better because we have a lot less errors coming back on our staff, so we're having to provide less feedback to them. The surgeons and the people in the room aren't having their cases delayed or held up. They're not seeing things that make them question sterility, question whether the instrumentation is safe for the patient. So I think it's all around been a pretty positive change.
That's wonderful. Is there anything specific that you want to call out in terms of the impact that this conversion to Microline has had specifically on the operating room and sterile process?
I mean, it for sure is prevented delays to cases. So every time that a tray gets turned away because of having instrumentation in it, it could possibly delay a case and affect the patient outcome, depending on how long that case goes or if they have to even reschedule the surgery. For sterile processing in general, we've saved a lot of time and resources. So when we had those dirty instruments in the past and we couldn't get those cleaned, you're just sending those back and forth, and that could tie up one person for several hours. Whereas having instrumentation that you can take apart and clean and that you can know it's safe, you can put that set together in almost no time and move on to other things that could be important as well.
Wonderful. Working in sterile processing myself, I understand the impact that any sort of process improvement or implementing any sort of innovative or disruptive technology that will help prevent those errors and help assist our staff in focusing on what we're there to focus on, that's always going to be a benefit. John, one additional question that I have for you: when your team goes into different facilities, we talked about the advantages of the Microline products, but what are the main pain points that you speak to often when your staff goes into facilities, and really where your solution comes in and really meets the needs to solve those pain points?
Yeah, I think, again, our approach is to go in and ask questions, and many times they get into a conversation with someone in SPD, and we say, hey, we start talking about the laparoscopic instrumentation. We ask, can we see it? Can we actually see the tray? And when we get that in front of us, we start looking at the number of instruments. We start looking at the duplication of instruments. So look at all those things, and we start asking those questions. And it really, in a way, it kind of takes off on its own, because if anybody understands the efficiencies in a lab set, it's people in SPD, because they know. Because we will be, first thing we ask is, hey, you got 12 instruments in here. What do you use for lab chole? And everybody, yep, we use about 3 instruments. All right. And I use that analogy. It's kind of like a high school football player. You practice all week, and when it's time to come in the game, you sit the bench. That's what these instruments are doing. These other 83% of these instruments are just sitting the bench, but they got to go through the rigors of sterilization. They got to go through that whole process, which is very time consuming. So it really is that type of conversation in SPD is, generally speaking, when we have that. You're right.
Joseph, you go in and out of different facilities. You talk with department managers, you talk with frontline technicians about the value and the advantage of disposable laparoscopic or even reposable laparoscopic instrumentation. What is one thing, like you've obviously surveyed the scene in a lot of different states. You've seen just what Adam was talking about, many facilities having those 3 different generations of laparoscopic instruments that they're trying to work with and trying to make use of. What's the one part of the conversation that you always see that aha moment or that light bulb go off when you talk about your solution?
It just what John referenced. What do you use for a lap chole? 3 pieces. How many are in there? 12, 13, 14, 15. And then the next step really is, and that's only 13, 14 one-piece instruments. You add 2, 3, or 4-piece take-aparts, and now you're talking 50 pieces. What are the turnaround times of those trays? Now, for us at this stage of the game, SPD really isn't the challenge. SPD gets it every time. Everybody in SPD gets it every time. It's the next step, whether that is the folks in the OR that don't care or view the people in the basement a certain type of way, or a director of surgical services or some of those people that don't want to put resources and time toward laparoscopic problems. It seems like everything goes toward ortho, right? Ortho, heart cases, it's going in a different direction. So SPD is always on board. Here and there, you'll catch traction once you make it upstairs. And then somewhere in between, it starts to kind of lose its momentum, or it can. Those are some of the biggest challenges.
Do you have advice for, you said sterile processing gets it, and I understand that that's probably the case, but what advice do you have for a sterile processing leader who is looking to implement this change, looking to make a conversion, but they're just not making the kind of traction that they'd like to see? Do you have any advice that you can give them?
Just to stick with me. If you help me champion this program through the hospital, I will put the presentation together to present it to the people that have the dollars. But you have to stick with me, because I can't champion it without you. We need a team to power through the entire process.
Yeah, and if I could comment too, Lindsay, we talk to our salespeople about legions of champions, okay? And that's what you get SPD, and you ask SPD, you bring me to this person for the OR, and that you get, so that, when you get all of these people all shaking their head, yeah, this is what we need to do. And then, the challenges, of course, is bringing all this information, but you want to be marching down the hall with your legions of champions. It makes it a lot easier.
Wonderful. Well, guys, this has been an enlightening conversation for me, and I know hearing from Adam is going to resonate with a lot of professionals in the department. Hearing that peer perspective is a very valuable perspective to get to hear, and it doesn't happen very often, especially in the virtual world that we live in right now. From the Beyond Clean team, we are honored to be able to shine a spotlight on the innovators and the disruptors of the industry, and it's clear that your company is one of those. So thank you for taking the time to talk with me today. Why don't you give our listening audience, those who are tuned in to SPX 2021, a way to contact you should they want to find out more information?
Sure. They could either go on to our website, www.microlinesurgical.com, and in there you could certainly request a contact. You could call our corporate offices and just ask for the representative for that particular area, and certainly our reps would be more than willing to come in and sit down and start that consultant process.
And Adam, I want to give a special thank you to you and to your staff and to all the frontline technicians and department leaders who are championing important change in an effort to increase the opportunity to provide safe patient care. So to you and your staff, congratulations. It sounds like you have some great support from the Microline team, and thank you for sharing your firsthand testimonial with us. We really appreciate it.
Absolutely. Thank you so much for inviting us on to participate.
Absolutely. All right, everyone. It's been a pleasure talking with you. For everyone who's tuned in, thank you for joining us for SPX 2021, and we'll see you again soon.